It is just after 1 o'clock on a Wednesday. Welcome to the ACSA Legislative Lunch Break, along with Edgar Zazwat, ACSA's Senior Director of Policy and Governmental Relations. I'm Naj Alikhan, ACSA's Senior Director of Marketing and Communications. Welcome. We are so happy to have you with us today. Go ahead and jump onto our chat, say hello. Let us know where you're watching from. Edgar, good to see you. We've had a busy week, a busy end to last week. How are you?
I'm good. I'm having flashbacks here. I'm back at home. I've been in the office for most of these for our telecasts here, but I think you kicked me out of the office today. I was in there. You were telling me we were having some internet issues, so I think I was having flashbacks of running around. I forget what it was, Ledge Action Day or whatnot.
Action Day, yeah.
I had to find a good, proper internet location, but you look like you're fine. Maybe you just didn't want me around, and that was the real reason.
Let me just set this up for our members, because Edgar and I have been in the ACSA headquarters doing this show for some time. But none of our viewers are immune to the issues with the internet that I have normally deal with. Today, here in the ACSA headquarters, we are having internet issues to the point where, Edgar, a metal hanger and aluminum foil hat is not going to be enough for me to get a decent internet signal. So you may automatically become host of this entire show at any point today. So get ready.
Yeah, I don't know if I like that power. I don't know if I let, you know who I'm going to blame here? I'm blaming Wes, because that's the easy thing to do, short timer, or that's the easy way to go, right? It's Wes' fault. So I'm gonna file a complaint. Still on the job for a few days.
You and I have joked, when there's an internet issue with one of our guests, we can blame the superintendent or the governor or somebody like that. Today we can blame the boss, because, well, he is a short timer. So we'll go ahead and do that. Again, go ahead and jump onto our chat today. Say hello. Let us know where you're watching from. Just want to give you a programming note. Because we'd like all of you to be completely updated. We are not going to be on the air next Wednesday unless there is some type of breaking news. Edgar and I are going to be in 3 days of governance meetings next Wednesday, Thursday, Friday. Hello, Costa Mesa. We're going to see you in person. So unless there is breaking news, we will not be on Wednesday. But the following week, apparently, we're working on a pretty big guest, so you'll definitely want to join for that. Edgar, I do want to hit a couple of news topics before we move on to our guests and start talking about the student vaccinations. There was this story that was in the LA Times this week about violence at school board meetings and just attacks, violence against school leaders, school board members. And then this story came out in the national headlines that the FBI and the Justice Department will help protect school employees amid an uptick in school violence, that the Attorney General has directed the FBI and other agencies to discuss strategies for addressing the trend. We've covered this topic. We've heard from our school administrators about this, but I want to get your reflections after reading that LA Times article and what we said there. And now we see the federal government is going to start putting some resources into this. Tell me about your reflections, what you were reading.
Yeah, I mean, first of all, it's hard not to see that. And a good reporting from the LA Times, I think, was a good summary on some of the individual cases we've heard from our members around the state, right? So they did a nice job of summarizing that. But it's a bit stark. It's a bit humbling to just see that's what we're dealing with. Our educators get into this industry for a lot of reasons. I don't think any of them expect that they're going to be on the receiving end of whether it be death threats or violence or just having to deal with this on a regular basis. But unfortunately, it is the sign of the times that we're dealing with. We're dealing with difficult issues. I mean, hence the topic that we're talking about today. We know it's soliciting a lot of reactions around the state. I think a little bit of credit is due to not just, the authorities at the federal government to start taking this seriously, but a bit of a shout out too to some of our friends, CSBA. I know Vernon Billy and the School Boards Association and NSBA, their national affiliate, have been trying to put some spotlight on these bigger issues as well, in terms of what is the risk to some of our folks who are just there trying to serve kids and now having to worry about their safety. So hopefully this is something that gets a little bit more attention and we put the appropriate protections in place.
Yeah, totally agree with you. And let's hit the big news story from the end of last week. And that was the new student vaccination mandate. Let me just read a couple of details, Edgar, and then we can talk about this and then move into our guests. Announced Friday at 10 a.m. That the state will be adding the COVID-19 vaccination to the other vaccines that are required for in-person school attendance. This would apply to public and private elementary and secondary school students. It will be a phased-in approach, and unvaccinated students can still be enrolled in independent study, but they cannot be enrolled to attend in-person instruction. Of course, there are some exemptions for medical reasons and personal beliefs. A lot of this is upon full approval by the FDA, but based on the current projections for full approval for ages 12 and up, anticipate the requirement going in for grades 7 through 12 on July 1st. And Edgar, this is something that I do want to point out and get your reflections on. 5 California school districts already have implemented their own mandate. Culver City Unified, Los Angeles Unified, Oakland Unified, Piedmont Unified, and San Diego Unified. I believe the San Diego one just happened last week or maybe the week before. Your reflections when this news came out Friday morning, and how what is the reaction you've heard since?
Yeah, well, there's a lot of reaction, so we'll start there. Let's just say in general, there's been a lot of reaction. I think to the point, it's varied. Look, and this is where I think us at ACSA are very realistic, that this conversation is playing out very differently depending what community you're in, depending what are the underlying circumstances, right? I think on one end of the spectrum, for those folks that have already gone down the pathway of having a local mandate, I think this was very welcome news. I think this gives them some cover in terms of those that are already trying to challenge them legally, at least, or practically, in terms of knowing that there's a state requirement coming in. The flip side of this, as we've expressed in our response, is we all also understand that there's going to be a lot of concerns from our members, whether it be about students trying to seek other options, deciding that they're not going to come to school and maybe that it leads to declining enrollment, or this issue that we've been hearing a lot about what's going to be the impact on employees, which we're already facing some shortages. Like, what is going to be the potential impact there if employees decide to go and look for other options in terms of employment? So it's varied. I think us at ACSA, we're trying to navigate this. We're trying to figure out what are the tools that we need to put in place. All said, I think we've all been very consistent here. We do believe that getting as many people vaccinated is the pathway out of this pandemic. Yeah. And I think for that reason, if nothing else, we're supportive of that effort.
Yeah, and we've heard the governor say that quite a few times about vaccinations as our way out of this pandemic. Well, let's bring our panel on today. We got a full panel for you today. Ben Cheetah is the Chief Deputy Cabinet Secretary from Governor Newsom's office. Brooks Allen, Executive Director of the State Board of Education. Dr. Sahil Sood is the lead on the Safe Schools for All team. It is great to have all three of you on here. We got a packed group on, so happy to have you guys. I'm going to ask just right off the top here. Last week, we had this big announcement came down Friday. Ben, I'm going to have you start. Can you walk us through a broad overview of what this looks like and what the pathway is to get to that July date?
Yeah, absolutely. I'd love to. And just first, thank you to everybody. I know that there's so little time in the day, especially personal time. And I appreciate that you're taking some of it here to chat with us. Really, the dots between what we were just talking about and the governor's announcement from Friday, there's a very close linkage. The governor wanted to make sure that he was clear on what the state was doing and leading on in order so that it wasn't a decision. These aren't decisions that need to be made one by one, school board meeting by school board meeting, et cetera. So just to give you a little bit of overview, you all have been, the big picture story in California is you all, because of your work, have been incredibly successful in keeping California students safe and in person. And so what we're seeing nationwide is our pediatric hospitalization rates are dramatically lower than the other states and the national average. Likewise, we're seeing that the number of school closures that we're seeing due to COVID in California is a fraction of what other states are experiencing. This chart here shows that, for the most part, all the outbreaks, closures in California are very rare relative to the number of schools that we have, and they tend to be localized in communities where vaccination rates are lower. We have been open for a month longer than many other schools in other parts of the country. And even then, our schools have been best in class in terms of safety and staying open. The thing is, though, we know that's not magic. That's thousands and thousands of hours on your part, hard, heavy lifting. And we also know we can't do this forever. And so that's what prompted the governor's announcement on Friday. There's a really well-established process in the Health and Safety Code for adding additional vaccines to the list of required immunizations and vaccines. It's helpful to actually see the language itself. Here you are seeing the main provisions of the Health and Safety Code. One part of it is the scope is it applies to both public and private schools. So we're not going to have different rules for public and private schools in terms of required vaccinations. Another important thing to note is you have these 10 vaccinations that are codified in statute that are actually written into the Health and Safety Code itself. But then you have this 11th provision that says the Department of Public Health can add additional vaccinations as well. And that is what the governor has directed the Department of Public Health to make operative once it's appropriate to do so. Here's what that means for students. So what that means for students is that if we do use that last provision, number 11, to create new regulations that set the requirement under state law, then both medical and personal belief exemptions will be included. That's part of the existing Health and Safety Code, and we will make sure to follow that provision. Likewise, if a student does not get an exemption, either medical or personal belief, pursuant to those regulations, then the student can always choose independent study. These vaccination provisions in the Health and Safety Code do not apply to independent study. So that is always the backup option. As Edgar noted at the top, there is also a question when it comes to staffing. And so here's what that means for staff. By the time the first student mandate becomes effective, the verify or test requirement that's currently on the books from CPH will be converted to a mandate. This is really because the governor wanted to make clear to our health officials and our agencies that adults in schools should be held to at least the same standard, if not a higher standard, than the students. So we want to make sure that by the time the first student mandate comes into effect at the state level, that there is also a corresponding staff mandate as well. Now, in terms of timing, which is probably the biggest question for many people, if you're worried about having to scramble this week or over the weekend, that is not the case. A little bit of 101. So first, the Health and Safety Code divides up the applicable student groups by grade span. So we're looking at K through 6 and 7 through 12. And then a little bit of 101, you might hear these different terms like emergency use authorization and full approval. I'm not really sure what the distinctions are. But in short, when the FDA provides the emergency use authorization, they are determining that the vaccine is safe and effective. But having said that, there's still another step before they actually do the full approval. And what we are going to be doing as an administration, as a state, is waiting for full approval for the grade spans. And so essentially the timing that you should expect is full approval for grades 7 through 12 or grades 6 through K through 6, and then the rulemaking process, which is the process for making regulations, which includes notice and comment and sort of the back and forth that entails. And then the requirement will be effective the following January 1 or July 1. Now, a couple of questions that folks have raised is like, what if you get full approval right when right at the end of the year, right before January 1st, et cetera. And so just to kind of really be very clear about the factors that we're looking at, the factors that we're looking at for timing are FDA approval. We have to then consider the recommendations of 3 entities. before we initiate any requirement. And then we have to consider the time it'll take to actually go through the public rulemaking process. And then number 4, of course, we need to make sure that we have a reasonable time for implementation for both the schools and for the parents themselves. So our best estimate for when a requirement for grades 7 through 12 will be implemented or effective is July 1, 2022. And then in terms of K through 6, we don't have the emergency use authorization for kids in that age group yet. And we expect it at the end of this month. Because of that, we really don't have sufficient information to be able to provide an estimate at this time. The last note I want to just make on this before we move to questions and conversation is this is our state requirement. This is going to be the state action, but we want to make sure that it is clear that locals also have this additional authority if they want to accelerate any requirements. There are a number of districts that have, so if local health jurisdictions or school districts want to accelerate this timeline, then they are free to do so. Some districts have predicated their requirement on the emergency use authorization. Others have done full approval. The statewide requirement is really to do what the governor said on Friday, which is mark the path to getting out of having all of you have to be also dual hatting as health officials and working on, testing and all these other elements that we know are hard to add to your plate, in addition to all the other work that you need to do to focus on instruction and mental health, social emotional well-being, and the other priorities. So really what this is a state requirement that's intended to follow the established procedures to effectuate the health and safety code's goal of total immunization of appropriate age groups against harmful diseases. So essentially it is a marker that even if locals move forward ahead of time, it is still the case that there's going to be a point at which, at the state level, there is a requirement, and hopefully we achieve 100% vaccination of both students and staff. And at that point, we're really, we can really worry less about the things that are causing us work and lost nights of sleep right now. So that's the overview, and happy to chat further.
Thanks, Ben. Before I ask my next question, Brooks, Dr. Stood, anything you want to add on just in terms of overview? Obviously, you hit on a number of the things, Ben, that people have been asking about, when we anticipate this going to affect. I think you touched on, we'll do some follow-up here, but I'll just pause for a second if either of you wanted to add on there.
Nothing from my end. Good to be with all of you. I think Ben provided a really nice recap of the situation.
Right.
Yeah, similarly, really interested to get into the conversation, and I just want to reflect on all the important feedback we heard from so many, including I'm sure many who are on right now, up and down the state as this policy was developed, and so really appreciate that.
Yeah, Brooks, and on that end, it reminds me two things. It just, thank you. I know you met with some of our members last week to try to get some of this feedback before the announcement. But with that said, I also acknowledge that you folks have been talking to different districts, to some folks around the state, and you've been hearing this. And one of the things when we were setting this up, you know that the reaction is strong on many angles, and you're inviting that. And I know Gianna put that in the chat, but we would invite, as we're talking about this, give some perspective of what this looks like, what the reaction is, to our members. What is this? How is this going to play out in your community? I know that's something that the governor's office was interested in. Brooks, this might be to you, but you can hand it off if need be. Ben talked about I'm asking you to put on your attorney hat here. What in terms of the personal and religious belief exemption? Ben talked about that's part of the process because you're going through this regulatory process. So we've been getting a lot of questions about what will that look like? Will this be spelled out as part of the rulemaking process, or is this going to be something that there's going to be discretion at the local level? Because obviously that would have some consequences as well. So maybe if you could just lay that out to us, and maybe, I know we understand, but there's already chatter maybe from the legislature about what they may do. So maybe you could just fill in the gaps there for our folks. Yeah,
I'll certainly take my best stab at it, and then if others want to fill in, I mean, the real simple answer is that the student exemptions are established in statute, and as Ben described, what we're doing in terms of where the governor's directed CDPH to go is to move through the emergency regulations process that is shaped and limited by those statutes. And so to the extent that both we have the medical exemptions and the personal belief exemptions, those are statutory in nature and therefore would have to continue to apply through regulations promulgated under those statutes.
Let me go ahead and go to a question here from Michelle Eklund over at the Placer County Office of Education. And Dr. Sood, I'm going to have you maybe address this right off the top. Michelle asks, are there any anticipated changes to the universal masking policy for K through 12 schools, given that California has the COVID lowest transmission rate across the country? Or can we anticipate keeping masks until the implementation of the vaccine mandate in July of 2022? Dr. Sood, Ben had that data right off the top that showed, you know, where we are as far as vaccinations, where we are as far as, you know, the rate of infection. Do you anticipate any changes related to masking as we head into July 2022?
Yeah, well, thank you for the question. I think it's undoubted that we are doing a really good job at getting through this Delta surge and really averted much transmission and much disease due to the efforts of everybody on this call and everybody in the state and the communities thereof. So we are moving in the right direction. And it is true that California is leading the way, but there is certainly still a long road ahead of us. If you look at some of the CDC maps and you look at it by county, the vast majority of counties in California are still in the highest tier in terms of transmission. And so while every part of the state is marching down in the right direction, we're not quite there yet. So geographically, much of the state is still in red. And that is combined with the fact that, you know, as Ben and others have been mentioning, a large majority of kids have no access to a vaccine at this point, particularly the 5 to 11-year age group, right? We are anxiously awaiting and eager to learn more about emergency use authorization in that group, but that is yet to come. So we're looking into these factors. They will play a role in how we consider and think about masking. But not necessarily, committing to tying one to the other directly in any shape or form. As folks probably know from our guidance, we did mention that we will revisit the masking mandate on or before November 1st to at least provide additional guidance of how the winter months could look. And so we are working toward that and hope to share something soon.
Lots of feedback, lots of questions, so we appreciate that. So we're going to try to get through as many of them as we can. Next question, and this is probably either for Ben or Brooks. I think Naj touched on this in the opening, but in terms of the options that districts will be able to provide for students if they don't want to get vaccinated, is that independent study? And then we got a related question about if somebody qualifies for an exemption, are they allowed to enroll in in-person instruction? Yeah,
I'm happy to take that, Edgar. So I'm actually really glad we got that question because it's a question I've seen come up a lot over the last few days. So to be really clear, if a student is exempted, they can enroll for in-person instruction. That's what the exemption means. And then as Ben referred to earlier, if someone isn't eligible for one of those exemptions, and once the grade span goes into effect and the requirement would apply. So again, looking potentially at the earliest of that being the case as of July 1 of 2022 for the grade spans of grades 7 through 12. At that point, that person, that family would have the choice of either independent study if they didn't want to be vaccinated, if they did not qualify for an exemption.
Let me go to Kent Kern's question, Kent over at San Juan Unified, and really he's asking for some clarification. So Kent asks, we are already seeing a shortage of staff to provide independent study at elementary and secondary schools. If this goes into effect in January for secondary schools, we will not have the staff needed. Ben, can you clarify, because you gave us the timeline near the top of the show, just so we can make sure there's clarity?
Yeah, so I think that, given where it is, July 1, 2022 is really when folks should be planning for. Given the considerations that we outlined around when full authorization will come, which we are not sure about, the time it will take to consider the recommendations from the bodies, the actual rulemaking process, and making sure that that's all the requirements of that public process are fulfilled. And then on top of that, of course, making sure that there's a reasonable period of time for both schools to implement and also parents and staff to also get the vaccine. So with all that in mind, it does appear to be July 1, 2022, just for clarity and for planning purposes. And just to be clear, that staffing consideration was top of mind for us in so many different ways. I mean, it's top of mind for us right now, totally apart from the vaccine mandate question. We hear loud and clear the shortages that are really impacting the ability to deliver for students, but also to even keep schools open in some cases. So, it is very acute. We do have a number of measures in our budget, including $2.9 billion to help with the teacher pipeline and making sure that that is as robust as possible over the next several years. But we're mindful that that some of these challenges are more immediate term than that. So part of what we're trying to do here, and part of what we think hopefully this timing will work out well with, is right now you all are focused, rightly so, on keeping your schools open and addressing the mental health and other needs of your students, the most acute needs. That is the exact right thing. We want to keep your eyes on that prize. And hopefully this is more of the pathway that we're marking out for how we get out of this whole thing altogether.
Back to a question about the personal belief exemption, and I think a few people asked this one, relates to staff, right? I think the statute talks to that. I know you folks touched on it. I don't know, Brooks or Ben, you want to clarify it. What exemptions, if any, would apply to staff once this action goes in place?
Yeah, I think one thing I would probably be really clear off the top is that we're talking about these exemptions for students are established in existing code. And so when we're talking here about the health and safety code provisions that Ben put up on the screen, we talked about the regulations promulgated under them and how the personal belief exemption and the medical exemption applies. It applies for students, right? So that's very specific for the student side of things. When we talk about what might be anticipated for the school workers side of things, it's useful to really look at really what happens in terms of what's governed by employment laws. And so the analog here might be the medical worker order that was put into effect, and we look at the exemptions that would apply there. They're not identical, but there is a rough overlap in terms of how they put that together.
Dr. Sid, I know that you are you're up against the clock here, so I do want to just get your reflections real quick on this mandate and what you expect to hear from some of the parents, some of the families, maybe as we make our way towards it. What are some of the challenges that you expect to hear as we move towards that July date?
Yeah, I anticipate continued conversations that we've been having throughout the entire time vaccines have been available. Concerns and questions about the safety and the efficacy of the vaccine. And to Edgar's point at the top of the show, vaccines are our ticket to normalcy because they are our ticket to safety. No vaccine in history has received this much scrutiny. And at this point, today in California, I believe it's more than 1.7 million children aged 12 to 17 are fully vaccinated. And so there's a lot out there that we already know. And specifically around, if I could take a moment to address a few questions that typically come up. So around safety, whether these vaccines are safe, I would say resoundingly so. Side effects absolutely occur, the arm soreness, the fever for a day or so. And all that means that the vaccine is working and that it's revving up the body to fight. And sometimes when that body revs up, it does rev up to cause, a condition that some folks have mentioned some concern about, namely a little bit of inflammation around the muscles of the heart. And I can tell you, last time I was on the show, Edgar, we talked about how I was a practicing pediatrician. I've taken care of a child with that condition. Teenage male, that tends to be the typical demographic, usually after the second dose of the vaccination. And he had a little bit of pain when exercising. He walked into the hospital, got a day or so of an evaluation, and walked out of the hospital. That's on one hand. And I'll tell you on the other hand, I've also done chest compressions and given CPR to a child who's died with COVID-19. And I wish that on no family ever. So, I think stars every day that doesn't happen very often in children. Nationally, that's about 400 school-age children have died from this condition, but that's 400 too many. And particularly when we have a way to prevent that. And so, even though, complications can be less common in children, I have no hesitation that the vaccination is the right choice for all those who are eligible. So maybe I'll leave it at that. I do apologize. I'm so sorry I have to run, but thank you for allowing me to be part of this conversation.
Muted, Naj.
You would think after all this time, I'd have figured that out. Dr. Sahil Sood, lead on Safe Schools for All team. Dr. Sood, thank you so much for being with us. We're going to go ahead and just continue with Brooks and Ben because I know that we must have like 30 questions here, Edgar. So I will just hand it over to you.
I'm going to try to summarize a few of these. This is an issue we've heard about. Naj, you at the top of the show were talking, you noted all the local districts have already moved in the direction of having their own local policy. So we've gotten the question about how a state requirement may reconcile with some of the local efforts, specifically as it relates to the exemption. So in other words, let's say District X sets up a policy. They don't allow for a personal belief exemption, but the state policy does. Is that something that, this is, we're all getting these questions as they come, it's sometimes good when we get stumped. Is that something that's been given any consideration of how that would work legally?
Yeah, I think one important thing I think I should just say at the top for this is when we talk about emergency regulations process, it's early, right? I mean, one of the points, as Ben highlighted, was we thought it was really important in part in response to what we heard when we were all together, many of us last Thursday, and we're talking about these issues, is to try to give some clarity about where we're headed. But emergency regulations process obviously goes through a comment period. And so the details of how that gets worked out may be worked out during that process at that point in time.
I would also just add that's exactly right. And I would also just add that, it's the sort of traditional way that the state and local laws work together. So the state law, typically is the sort of backstop or the floor. People describe it as many different ways, but sometimes they say the floor or the backstop or things like that. Locals are always going to be able to, almost always under law, going to be able to move forward ahead. They're going to create stricter requirements. And all of that. So that's all to say that, this is a natural sort of push-pull function of state and local laws. And as Brooks noted, really what the governor wanted to do was give everybody, you all, parents, everybody, as much lead time as possible to know that this is coming. But we are still going to have a public process based on existing law that will articulate the details of this requirement.
This is a good question that came up. We've got so many that are coming in, but I wanted to just ask from what is the strategy and what are we trying to accomplish? Helio asked the question, what outcome does the governor want to accomplish with mandates that are divisive, very much so with the vaccine? Why are more restrictions on educators who simply can't keep up with the barrage of mandates needing to be enforced? I guess that would be my question because, what is the strategy? What are we trying to accomplish? It's obviously easy to say we're trying to get the vaccine as widespread as possible because that's how we end this pandemic. But because you guys are working with the governor, what is the strategy? What are we trying to accomplish?
We're trying to accomplish exactly that, which is, you all are lifting heaven and earth to keep your students safe and your schools open right now. And that's a big taxing load of work to constantly have to lift. And it doesn't help us do the really exciting work that got us into this job of, transforming our public education system to really center on students' mental health and social, emotional, and academic needs. That's the stuff we want to do. we don't want to have to be constantly worrying about, testing or ventilation or, masking, all these things. So really what the governor wants to do is mark the clear path, the light at the end of the tunnel that will help us get out of this frankly miserable situation that we are all in which we are constantly scrambling to try to adjust to this incredibly dynamic and hard to control virus. So that's one thing. And just the second thing is to loop back to the start of this conversation. The governor doesn't want 1,100 plus, school board meetings in which this has to be fought over. He doesn't want these, every governing board of every charter school and every school district and every private school to have to debate this and fight this one by one by one. What we are articulating is a state standard that is clear and folks can think about and solve towards and plan for, so that we're lifting from the onus of locals to deal with these really admittedly challenging, in some cases, political and cultural sort of discussions.
I'll move in a slightly different direction, and Brooks, Ben, I'm not going to ask you to speak for your legislative partners because that's, we'll have other leaders to come in and comment on what their intention is. But just for edification purposes, folks are a little confused. They're hearing some chatter about the legislature could do something different. Maybe we just clarify that piece, that this personal belief exemption is in place again because of regs. What could supersede that obviously is statute coming in and changing that, right? If you just want to touch on that.
Totally.
Yeah,
Sorry, Brooks.
Oh, sorry. No, I'm happy to jump in. So, Edgar, you're exactly right. I mean, when we talk about we're promulgating the regulations under existing statutes, obviously, to your point, the legislature could come in, they could change those statutes. Those statutes define the scope of those exemptions that are applicable in this space. And so, we're bound within the confines of current law. Legislature, when they return, chooses to change the law, then obviously we're dealing with a different landscape at that point in time.
And Brooks answered that better than I could have anyway, so that's great.
That was too easy, Ben. That was too easy. Just said he answered it well. I'm waiting for Edgar to do that same thing to me. Najee did just fine. I'm not even going to talk about it. Paige asked this question at 127. Will the K through 12 mandate apply to K through 12 adult ed students as well? Obviously, if you're 18 years or older, then the vaccine is available. But is that going to be part of any language that changes that this will go K through adult, or are we just going to stay at K through 12?
Honestly, that's a good question. I don't know that I've specifically had a discussion about that particular piece of it, which I think helps underscore what Ben led off with, which is in terms of this point of the direction, and some of the details will be worked out as we move forward.
Go ahead, Ben. Go ahead.
I'll add a little bit to that too, which is just to say we'll follow the law on the books as our folks are able to interpret it, and so that's good. That's what we'll do, and really, I just want to again contrast this with some other circumstances where we've had to adjust to really exigent, emergent issues. And so sometimes we have to issue an EO or et cetera that does, it's a surprise to many school officials to implement it. It might be a lift to do so on a short time frame. This is not that. This is, us saying in the future, we will go once these conditions are met, we will go through a rulemaking process that will be publicly open for for weeks, and folks can provide their comment. We will respond to the comments. We will iterate on the regulations based on feedback from stakeholders of all stripes. And so what we're just saying here is, for a lot of these questions that are more specific to certain cases, a lot of that will be worked out in the rulemaking process as it is envisioned in statute.
This might be another question. You'll just have to tell us. We'll wait and see, but I'm going to ask it anyway. And this actually might have been something for Dr. Sood about what's the consideration or the thinking on testing and the role of testing as we go down the pathway when we have everybody vaccinated, whether it be for students or for the employees in the system. What are some expectations or even intent in terms of how that will work once we have full vaccination?
I guess I'll try to answer that as best I can, which is like the governor will always say the one lesson about Delta is that it's humbling. That's the catch. That is the word that defines COVID and Delta. It is hard to predict and project out what the future looks like. We've all experienced that in real time over the last 2 years. Trust me, it's not just you all that feels like, oh my gosh, things are changing here and there. We are experiencing the same thing. The nature of the epidemiology of the virus changes. The variants pose new risks. We learn new things about what works and what doesn't work. So that certainly changes quite a bit. When it comes to testing right now, especially when we're in an environment in which we don't have anywhere close to 100% of our students vaccinated, testing is a really critical tool, and many school districts are using it to great effect. And just a one quick plug, the state offers testing, several different options for school-based testing at no cost to the local. So please take us up for that. But at the end of the day, right now, it is a very helpful tool to manage COVID, as we've seen the results of in California as compared to the experience of other states. And whether or not we need to continue testing or any of the other mitigation layers once we hit 100% vaccination, it is hard to say. I mean, we can't say for certain because COVID is it's impossible to project out. But at the same time, that is what we're trying to achieve. That is what this is about, is trying to get to that point where we can really say, like, let's get back to normal.
Let me ask this, because as Edgar mentioned it near the top of the show about you guys have had the opportunity to get feedback. Obviously, with the number of questions that have come in, you can see that this is a very big discussion topic. The two of you were in a listening session last Thursday morning. Edgar and I were there as well, just to listen to the feedback from some of our district leaders about a vaccination mandate. And Brooks, I'll have you start, but can you just talk a little bit about what you heard from district leaders last week, and maybe how that got us to the point where a mandate was put in, and now we're here on a Wednesday, but just what you heard and how that kind of moved things along.
Yeah, no, I appreciate the question, Naj. And Ben last week, I think, summarized what we were hearing very well. I mean, and it speaks to what Edgar raised at the beginning of this conversation. We know how challenging the conversations have been, whether they've been around masking or vaccines in our local communities, the ones we live in immediately, in our own school boards, our children's own schools, as well as for all of you who are here leading school systems and then being asked to really play this health and safety role. And as Ben highlighted, this is an effort to ensure that those health and safety decisions are being made by the health and safety experts with the California Department of Public Health in consultation with the entities designated by statute to consult with after full approval of a vaccine to provide that clarity and to provide some certainty. And I'll say, Tanaj, to your question, what did we hear on that front in terms of requests for if there was going to be a statewide policy put into place? What did we want to hear? And we heard the themes that we've been hearing in the weeks leading up to our conversation last Thursday too. And a lot of those had to do around, if we're going to do something, let's be clear and let's have some specifics. Let's have it be with some lead time. And this speaks to a little bit of what Ben was highlighting about really looking at the earliest implementation date for these requirements be no later than July 1 of 2022. So it lets these questions like the adult ed question, others that are coming up, have a chance to be heard and considered. Using the regulations process allows obviously for a comment period during that time to further inform with circumstances that may not be fully anticipated or may be relatively rare but need to be considered. And also really trying to make sure that when we look at the implementation dates, another theme we heard in some of the comments, both verbally and in the chat last week, were around let's not drop it in the middle of a school term. Which it was consistent with our thinking, but that's why looking at implementation dates, we're looking at July 1, obviously as the beginning of any school year, as well as January 1 as a mid-year point. It's not something that kind of lands right there. And then finally, I think really hearing concerns about how we're able to keep things consistent across grades, consistent across what we do for students, and making sure that we are expecting the same of the adults in our school system when we're talking about trying to keep everybody safe. And so that was very consistent with the approach that that Health and Safety Code provides for addressing these in terms of grade span, and then moving forward with an action that really holds everyone jointly accountable and responsible for ensuring that our schools can continue to be some of the safest places, frankly, in California. And the way we're going to do that is to continue to move forward with, frankly, discussions and issues that haven't always been the easiest, right? I mean, we were having very similar discussion around masking earlier this year, and deeply challenging. I know leading to obviously not just the board meetings, but literally day-to-day interactions that are incredibly difficult. And I don't think anyone on here probably would anticipate 3 years ago ever having to tackle. And yet, having statewide consistency has also led to California being able to lead in making sure that our children are safe, and make sure that as a result, then our communities are safe and our schools can stay open. And then we can look forward to a progress where we are going to be able to get to a point we'll be able to look at schools in a way where we're not necessarily having to have health and safety leading off the legislative lunch events when we get together and talk about this. And we can really be talking about issues of how we address, as Ben was raising, student mental health, how we can make sure that we're accelerating the progress in educational achievement and success, making sure that all children have that chance to succeed. Talking about the exciting investments we have around expanded learning time, community schools, how we're getting more experienced professionals into the system at a time that not having to worry about health and safety issues and political issues being divisive enough to actually adversely impact our workforce issues. So I think for all those reasons and for all the things we heard last week, those all play in to the discussions that we were able to lift up for the governor to make his decision ultimately.
Ben?
Again, Brooke said it. Period. Exclamation.
All right. It has been an honor to have you guys here on the show. We know we kept you way past the bottom of the hour. Ben Cheetah, Chief Deputy Cabinet Secretary from Governor Newsom's office. Brooks Allen, Executive Director of the State Board of Education. Ben, Brooks, thank you so much for being with us. We look forward to having you on again next time. Thanks so much.
Great. Thanks so much. And thank you to you all.
All right. Well, Edgar, I don't know if we have ever had that many questions come in during one particular show, but clearly, as you would probably agree with, this is certainly a topic that has a lot of questions, requires a lot of clarity, a lot for districts that they have in front of them. I mean, there was a lot that came out of this conversation, and I think there's probably a lot more and many more conversations that'll need to take place.
Yeah, I mean, if one thing we've learned from this whole ride we've all unfortunately been on is that this is just the beginning of this, right? As they said over and over again, as some of these rules actually get made, what happened last week, actually, there was no enactment of a law yet. There was no policy necessarily developed. It was an announcement that this was going to happen, right? That there's going to be this regulatory process. As some of these questions come up, I guarantee we'll be back on here trying to decipher that, trying to look at the legal implications. I will also say one thing that really stuck out at me. We started the show talking about the LA Times article, right? About what our members are facing from around the state. And a number of members made this point, which I think is a really important one that we all need to continue to elevate. That one of the things that sometimes is lost, especially on our local communities, is that it's not our members who are creating these rules, right? They take the brunt of it, but it's not our folks who are making the policy. Now they are put in a very difficult position to enforce or to implement them. And I think that's the conversation, the narrative that we need to continue to keep in front of our policymakers in terms of walking that fine line, right? In terms of what is the intent of the policy, how is this actually going to play out in practice? But I think it is an important point where we've talked about so much of the anger and fear, and now some of our members' safety is in question. It comes back to this issue that they're the ones taking the blame. So I think us at ACSA trying to help navigate that difficult terrain too is probably something we need to continue to focus on.
Yeah, I was struck by a lot of the comments that came in over on our chat, talking about the importance of having these state guidelines and clarity, but also just the impact that the divisiveness has had on school board meetings and in schools themselves. It was a very common theme and something that I definitely think we're going to have to go a little bit more in depth on as we move forward. Folks, do want to show this to you. We've got leadership Summit coming up first week of November. It's a very, very exciting in-person event. We're back in person in San Francisco for a Wednesday, Thursday, Friday, and part of Saturday. Here's a little preview of what we've got going on at Leadership Summit. Yes, Leadership Summit, November 4th through 6th in San Francisco. You can register at ACSA.org/professional-learning or go right to our website, ACSA.org. Again, November 4th through 6th in San Francisco. For those of you who are not going to be in person, we will have a virtual event that I will be anchoring for 2 days. While I'm anchoring that, Edgar is going to be there shaking hands and kissing babies and signing autographs and everything. We're getting one of those big cardboard cutouts of Edgar that he can sit at a desk and do autographs. Edgar, that's going to be a really great event and great to be back in person.
Yeah, it's good. It's good to see people, right? As much as we've been loving doing this I've lost track of time. I always love actually interfacing with our members. So it'll be a good week.
It'll be a good week. And folks, a reminder, we're not on next Wednesday. Edgar and I will be down in Costa Mesa. So look, if any of our members are in the Costa Mesa area, come say hello. We're excited to see our members back in person. Edgar, good to see you today.
Yeah, the one last comment I will make on this is, like, I know we say it so often and it's so hard because this is such a difficult time, but just try to hang in there in terms of all of these countless questions. We're going to get after it. We're going to, we'll grind through this. A lot of this hasn't played itself out yet. There'll be an opportunity for us to try to reconcile some of these issues of who's making these calls on personal exemptions and whatnot. So just stay tuned. We'll keep working on your behalf on some of these difficult issues. But good show, Naj. Thanks. Good seeing you. But next time, maybe you'll let me stay in the office with you.
You were down the hall. You were a little too close to me. Edgar, good to see you. And thank you, folks, so much for being with us here on the ACSA Legislative Lunch Break. We're back on Wednesdays. Have a great rest of the day, great rest of the week, and we'll see you next time.